And the motion calls for improved outcomes for people with mental health needs, and we all want that. But, Madam Deputy Speaker, prevention is better than cure, and it is simply not sufficient to call for ever more money to expand remedial capacity without addressing the root cause of the problem. It's a bit like having a leaky roof and calling for ever larger buckets to catch the drips. We need to fix the roof. Now, many will cite poverty, poor housing, not enough youth services as the cause, and they are all contributing factors, I have no doubt. But there are two less well understood, less well talked about, but potentially more significant factors contributing to poor child mental health. Now, the first, which has been mentioned already, is the clear correlation between the rise of smartphones and social media and deteriorating mental health in young people. Online harms, the extent of online harms, cannot be underestimated. My honourable friend, the member for Chelmsford, mentioned pornography. Violent pornography is now encountered by children routinely on the internet, 1.3 million visits a month by UK children to adult sites. Eating disorders and suicide content, again, as my honourable friend so articulately mentioned, child sexual abuse material and exploitation. Anxiety issues compounded by social media platforms where children stay up all night waiting for likes on their social media profiles. There's clearly a relationship between more time spent on screens and less outdoor activity, again, a good indicator for poor mental health. The more hours that children spend on social media, there seems to be a relationship with worse mental health. Now, the online safety bill going through the other place at this moment is going to deal with some of these issues, but I would urge ministers to encourage their colleagues in government to accept some of the amendments that their lordships have put down on strengthening the age verification provisions to make it absolutely watertight that children cannot access some of the worst of these harms. But we urgently need some proper research into whether it is indeed safe at all for teens to have smartphones, for teens to go on social media. Some have said that smartphones are as addictive as cigarettes, that they are the opiate trades of the 21st century. And I applaud the campaign group Us For Them in their Safe Screens for Teens campaign that is calling for proper research into the health impact of smartphones on teens and whether indeed, like tobacco and alcohol, it is necessary for there to be a legal age limit for accessing some of these platforms or indeed having a smartphone at all.